Do you know how much it costs to be a mother in the United States? Millions of women are celebrated on Mother's Day, but for many Americans, motherhood comes with an extraordinary price tag. From pregnancy and birth to years of healthcare, childcare, and education, it's more expensive being a mom in the US than any other country. Let's start with childbirth. In the US, the costs depend on insurance and whether providers are in-network with lower negotiated fees, or out-of-network, which will mean higher charges even if you're insured. On average, an in-network natural delivery will set mothers back $15,000. For a C-section, it jumps to $19,300. For out-of-network care, those numbers can double to more than $31,000 for a vaginal birth and over $44,000 for a cesarean. In Nevada, a C-sections can be as high as $72,000. Compare that to a private C-section in Canada at around $5,000. For the roughly 8% of Americans who have no health insurance at all, those costs can plunge new families into crippling debt. That's made worse by the fact that the US is the only wealthy country without federally guaranteed paid maternity leave, forcing many mothers back to work before they or their babies are ready or recovered. The Family and Medical Leave Act 1993 gives some workers up to 12 weeks off, but that leave is unpaid and millions of people do not qualify at all. In contrast, several European countries like Bulgaria, Croatia, Sweden, and Bosnia offer more than a year of paid maternity leave. Then, as the kids age, US couples spend about 40% of their disposable household income on childcare, double the rate of most other developed economies. In Germany, Italy, and Portugal, childcare costs are close to zero thanks to state subsidies and public support systems. But even becoming a mother in the United States can be a matter of life and death. The US has one of the highest maternal mortality rates among rich countries. Out of 100,000 live births, at least 18 women will die from complications in childbirth, most of which are preventable. In places like Norway, Ireland, and Switzerland, it's less than 3. For Black women in the US, the risks are even higher, with a mortality rate of more than 50, compared to 12 for Hispanic women and 14 for white women in the US. That huge gap exists because the US has some of the world's most advanced medical technology, as well as deep structural problems in healthcare access, inequality, and maternal care. The tragic reality is that in the United States, if women survive childbirth, they will almost certainly face financial strain from simply being a mother.